Make confident treatment decisions at all points of care. The CoaguChek Pro II system is used for the determination of PT and APTT by healthcare professionals in a point-of-care environment. Read this operator's manual, as well as the package inserts for all relevant consumables, before using the system for the first time. The CoaguChek Pro II pack contains the following items: CoaguChek Pro II meter, battery compartment cover, universal battery pack, power supply, star-shaped screwdriver, operator's manual, printed version in English. Manual CD-ROM contains PDF files of the operator's manual in other languages. Additionally, a handheld base unit for data transmission and charging purposes is available. Overview of the meter elements. Touch screen shows test results, information, icons, and results recalled from memory. To select an option, simply touch the button lightly. On, off button. Press this button to power the meter on or off. Test strip guide cover. Remove this cover to clean the test strip guide if it has become soiled, for example, with blood. Test strip guide. Insert the test strip here. Barcode scanner. The integrated barcode scanner can scan operator, patient, and QC sample IDs into the meter. Battery compartment cover. Remove to insert the battery pack. Charging contacts. Used for power supply and/or charging the battery pack when the meter is docked in the handheld base unit. Code chip slot. Insert the code chip here. Connection socket for power adapter. Plug in the power adapter here. Infrared interface. Covered by the semi-transparent panel. Supports data communication. Before using the meter for the first time, perform the following steps. Install the battery pack. Connect the power adapter to charge the battery pack. Set the current date and time. Enter your chosen settings, language, unit of measure, user administration if applicable, etc. Installing or replacing the battery pack. When shipped, the battery pack is not installed in the CoaguChek Pro II meter. Using the star-shaped screwdriver contained in the kit. Loosen the screws on the battery compartment cover until they are protruding about 4 to 5 millimeters. Hold the battery pack in your hand, with the wires and the plug pinched between your thumb and index finger. Plug the connector plug into the socket. Place the battery pack inside the battery compartment. Place the cover on the battery compartment. Make sure that the plug connector wires do not get pinched between meter and cover. The protrusion on the battery compartment cover fits into the corresponding groove on the battery compartment rim. Tighten all 4 screws until snug. Do not over-tighten. Warnings: you can only use the universal battery pack with the CoaguChek Pro II. Other batteries are not compatible. After installing a new battery pack, the meter should be charged at least 4 hours before testing, preferably overnight. Whenever the meter is placed on an active handheld base unit or powered by the power adapter, the battery icon is displayed. This icon shows that power is available and the meter can be charged if necessary. To start the charging process, immediately put the meter into standby mode by pressing the on/off button for approximately 1 second. Therefore, the meter needs to be connected to the power supply or in the handheld base unit. Removing the battery pack. If you want to remove a battery pack, make sure that the meter is shut down to prevent damage to the meter or potential data loss. To shut down the meter, remove the external power supply. Press the on/off button for about 5 seconds and release the on/off button as soon as the Roche logo is displayed and the meter beeps. Place the meter face down on a level surface. Using the screwdriver contained in the kit, remove the 4 screws holding the battery compartment cover in place. Remove the battery compartment cover from the meter. The battery pack now visible is connected to the meter by a plug. Carefully lift the battery pack and remove the plug connector. Warning: replace the battery pack within approximately 10 minutes to retain the date and time settings. Beyond this period of time, you may have to re-enter date and time. Replace the battery pack only in shutdown mode. If you have not set the date and time after powering on for the first time, or because the battery pack was removed from the meter for more than 10 minutes, you cannot perform a test. In that case, powering on the meter takes you immediately to the setup mode, where you must set the date and time. See later in the course of this section. You can open any displayed function by touching the button for it with your finger. Touch the button, then remove your finger from the touch screen. In the main menu, the following options are available. Patient test, to perform a measurement. Control test, to perform a quality control. Review results, to open already performed measurements, sample and quality control. Setup, software setup options for instrument. Logout, this is optional and only active when operator ID is set to active. From the main menu, touch Setup to open the meter settings. Touch the main menu button on the left to go back. For an overview of all setup options, please refer to the Operator's Manual Section 3.1 Settings Summary. Screen Setup. The Screen Setup area contains the options for changing the display. Contrast. Use the Contrast menu to adjust the display to your ambient light conditions and make it easier to read. Touch the upward or downward arrow button to change the contrast in the range from 0 to 10. Touch to save this setting, or touch to exit this menu without saving any changes. The display automatically returns to the previous screen. Parameter configuration. In the Parameter configuration menu, you can set the units for the display of PT test results and activate additional test parameters on the meter. Result units PT. Use the Results Units PT setting to select the units in which the result is displayed. This setting only applies to PT test results. Regardless of the settings chosen for PT, a PTT is always displayed in seconds. Result confirmation. In some circumstances, it may be useful for operators to confirm the validity of their results. Use this setting to prompt operators to confirm the results of every test. Language selection. Touch the upward or downward facing arrow to display the language of choice on the screen. If the arrow is just an outline, you have reached the end of the list in the respective direction. Touch the button to select the language of choice. Your selection is now highlighted. Setting the date. When you power on the meter for the first time, or after a long period without power, the input field for the date automatically appears first. The date and time must be entered before the meter can be used further. If at a later time a date adjustment is needed, go to the Setup menu, then select the menu of choice. Touch the checkmark button to save this setting, or touch the cross button to exit this menu without saving any changes. If this setup menu appeared automatically after powering the meter on, you must touch the checkmark button to complete the first date setting. Touch the back arrow button to return to the screen menu. The meter takes you automatically to the time settings. Setting the time. Touch the checkmark button, save this setting, or touch the cross button to exit this menu without saving any changes. The display automatically returns to the previous language screen. If this setup menu appeared automatically after powering the meter on, you must touch the checkmark button to complete the first date setting. Touch the arrow to the left button to return to the screen menu. Setting the display options for date and time. Select your preferred format for the date and time display. The current settings are highlighted. You can select one of the following display formats. Day, month, year, for example, the 29th of May 2017. Month, day, year, for example, 05/29/2017. Year, month, day, for example, 2017, 05/29. 24H or 12H. Option Setup. Sort. Sort refers to the order in which measured and stored results are displayed when you use the Review Results function of the CoaguChek Pro II meter. You can display stored results chronologically by date and time or by person, based on the patient ID. The sort option patient name is available only when used together with a patient list. Patient lists can only be created with a DMS. For more details, watch Section 7 Extended Functionalities, the Data Handling part. Beeper. The CoaguChek Pro II meter can display information visually and alert you to special circumstances with a beeper. The meter always beeps when it is switched on. When the beeper function is enabled, the meter beeps once when it detects a test strip. Preheating of the test strip is complete and you need to apply a sample. It detects a sample. The test is completed and the results are displayed. A long beep. An error occurs. 3 short beeps. An external power adapter is connected when the meter is on. The meter is docked. A barcode is scanned. We recommend that you keep the beeper enabled at all times. You can also activate a key click. When a key click is enabled, the meter clicks briefly every time a button is touched, facilitating the input of information. Auto off. You can set up your CoaguChek Pro II meter so that it powers itself off automatically if it has not been used. No buttons touched or tests run. For a pre-selected time period. Use this feature to save power and extend the life of the battery pack. If the meter is connected to the power adapter or the handheld base unit, the auto-off function has a different effect. The meter powers itself off after 10 minutes without user interaction, regardless of the selected settings. Connection. In the connection menu, you can configure the data exchange with external devices. The meter can be connected to a computer, DMS only, or to a printer only, or to both a computer, DMS, and a printer. In addition to this direct data output, test results may also be encoded as QR codes, which can be scanned to be used with other applications. QR code. If you have enabled the feature QR code, select the style of the QR code to be displayed. Plain text. Use this option to scan the result into a PC-hosted application, for example electronic medical record. In order to do so, you need an external 2D barcode scanner attached to your PC. Once scanned, the test result and related meta-information, for example date, time, comments, will appear as plain text in your PC application. Coded data. Use this option to scan the result into a smartphone or tablet app, or a PC-hosted application. URL transmission. Use this option to upload the result to a web-based service, for example such as an electronic health record, coagulation management software, etc. For this option, further parameters URL, encryption key must be set. For the options coded data and URL transmission, dedicated software programs or apps are required in order to use this feature. The encryption key menu displays 2 types of information which are required in order to identify and decode the transmitted test result. This information is required by the IT system, to which the test result is transmitted via the defined URL. This information needs to be exchanged once with your specialized service provider prior to using the URL transmission method. Contact your specialized service provider in order to exchange this information. Computer. The CoaguChek Pro II meter can connect with a computer or host system running appropriate software. To use this connectivity feature, however, you need the optional handheld base unit, or the meter must be configured for wireless communication. Watch the wireless network section. If no wireless communication is configured, the connection is established in 2 steps. The meter connects to the handheld base unit via infrared. The handheld base unit is either connected to a single computer via USB or to a network host system via Ethernet. This function can be activated by selecting computer or computer, printer. Select computer, printer if you want to activate both functions at the same time. The option computer or computer, printer, when activated, can be used together with a DMS to set up operator lists or patient lists, lists of patients to be tested. This eliminates the need for manual entry of these data. In addition, you can transfer test results stored in the meter to other systems for archiving or further evaluation. The option computer or computer, printer controls the meter's ability to communicate with a computer or a network or with a printer. Printer. Please refer to the operator's manual for how to connect a printer. ID Setup, System Administrator, Admin. In the default setting, the meter is not protected with an admin ID, and all setup options are accessible to every user. If you set up an admin ID, the following setup areas are automatically reserved only for the system administrator. Supervisor, that is, the person who knows the password, screen, options, ID setup, QC settings, diagnostics. If you forget the admin ID, contact your Roche Diagnostics representative. If an admin ID has not been set up yet, pay close attention to the buttons you press, because the characters are not displayed on the screen. Asterisks are displayed instead. Use the Numbers button to switch to input of numbers. Use the ABC button to switch back to input of text. Use the Backspace button to backspace and correct a mistake. Touch the checkmark button to save this setting, or touch the cross button to exit this menu without saving any changes. The display automatically returns to the previous screen. Enter the admin ID again. The keypad is automatically displayed again on the screen to confirm the first entry. Touch the checkmark button to save this entry. The admin ID is now set. Or touch the cross button exit this menu. The admin ID is not set and is therefore still inactive. Please refer to the operator's manual how to change an existing admin ID or how to deactivate an existing admin ID. Operator ID. If you want to create a list of operator IDs from which you can select an operator, additional software, a data management system, and the handheld base unit are required. For more information, watch the Extended Functionalities Data Handling video. In the default setting, the operator login is not activated. You can either activate or deactivate operator login on the meter. If activated, an operator has to log in before the main menu will be displayed and measurements can be performed. Activate operator login. Patient ID. If you want to create a list of patient IDs from which you can select a patient for testing, additional software, a data management system, and the handheld base unit are required. For more information, watch the Extended Functionalities Data Handling video. In the default setting, input of patient IDs is set to no. This means each test is simply assigned a consecutive number. However, you can require that a patient ID be entered or make it optional. You may select from the following options. No. Tests will be assigned numbers automatically. Optional, automatic numbering or list scan, manual input. Required, list scan, manual input. If you select no, the settings are now completed. For the options optional and required, continue by selecting the input format. QC settings setup. The QC settings menu contains options for enforcing the performance of liquid quality controls by the operator at specified intervals. It also provides the option of customizing the QC range in accordance with applicable local guidelines. QC range, liquid quality control ranges can be customized to comply with local guidelines. The QC range function enables you to narrow the default range individually for each test parameter. Activate QC range. You may select from the following options. Default range. Range provided in the code chip is selected and displayed. No target value is displayed. Custom range. The allowed percentage deviation from target value can now be customized. Additionally, you can choose between displaying the target value along with a control test result or not displaying the target value with the control test result. Touch the button with the setting of choice. Your selection is now highlighted. Select Custom Range. Touch the checkmark button to proceed with corresponding settings. The QC range screen opens and offers you the following options. Display target value on, off. Deviation from target value, percentage value. Touch on. The target value will be displayed with a test result, or off. The target value will not be displayed. Your selection is now highlighted. Use the arrows to set the allowed percentage deviation from the target value. Use the arrows on the left to adjust the number before the decimal point. Use the arrows on the right to adjust the number after the decimal point. Note: for the test parameter PT, the percentage deviation from the target value is always defined using inner values. Even if you have activated %quick in the setup, the meter always calculates the deviation using inner values. For more information, read the operator's manual or contact your Roche Diagnostics representative. In the left-hand screen, display target value is set to off. In the right-hand screen, display target value is set to on. QC, Quality Control, Lockout. QC lockout ensures that the optional quality control tests are run on a regular basis. This is independent of the operator. However, this option should be used if you work without operator lists. QC lockout is disabled by default. The lockout triggers are set once and are valid for all parameters. The events, time intervals, numbers, triggering the lockouts are counted individually for each parameter. You may select from the following options. New code, yes. No. Applies every time a new test strip lot is used. The general intervals are no. Daily, weekly, monthly, number of hours, number of strips. Operator lockout. Optional liquid quality controls can be used to ensure that an operator is performing tests properly on the CoaguChek Pro II meter. The operator lockout function constrains an operator, who has been set up in the list, to perform these quality controls on a regular basis. The option of setting up an operator lockout is available only when operator lists are created on the DMS. For more details, see Extended Functions Data Handling video. If you are not working with a DMS, only the QC lockout is available. See QC lockout video. Scan QC material. The barcode scanner of the CoaguChek Pro II meter can be used to scan barcodes from QC material vials. Important notes. What you need. CoaguChek Pro II meter. CoaguChek PT and or APTT test strips with matching code chip. When testing with venous blood. Standard blood collection device, syringe. Do not use anticoagulants, for example, ETA, cheatrate, fluoride, oxalate, or heparin, to collect the blood sample. When testing with capillary blood. Lancing device approved for professional use, for example, the CoaguChek Safe Pro Plus lancing device or the CoaguChek Lancets. CoaguChek capillary tubes, bulbs, optional. Do not use glass capillary tubes or capillary tubes that contain anticoagulants. Cotton ball and alcohol wipe. Preparing to test. Have the test strip container at hand. Make sure that the code chip supplied with these test strips is at hand. Powering on the meter. Place the meter on a level, vibration-free surface, or hold it in your hand so it is roughly horizontal. Power the meter on by pressing the on button. You can also power on the meter directly by inserting a test strip or connecting the power adapter. If the function operator ID is inactive, wait until the main menu is displayed. If the function operator ID is active, without operator list, you are now prompted to enter an operator ID 1. Enter the operator ID using the keypad. Touch to move to the next screen. Alternatively, the operator ID can also be entered using the built-in barcode scanner. When the tests are completed or another operator wants to perform additional tests, touch Logout to log out. Performing a test. Without patient list, touch Patient Test. If the patient ID option was chosen as either optional or required when the meter was set up, see Video Meter Setup Patient ID. You are prompted to enter a patient ID. With Patient List, touch Patient Test. Touch In to display the entry of choice. Select the patient to be tested from the list. If the patient is not in the list, touch New to create a new entry. You must now enter a patient ID using the keypad. Alternatively, the patient ID can also be entered using the built-in barcode scanner. Touch Scan and scan the patient barcode from a distance of approximately 10 to 20 centimeters, 48 inches, according to the barcode size. The meter beeps once the barcode has been read successfully. The barcode information appears in the patient ID field. The scanner turns off after 10 seconds, if a barcode is not scanned. Touch the button to select the parameter you want to use. The test strip icon prompts you to insert a test strip. Remove a test strip from its container. And close the container again with a stopper. Hold the test strip so the lettering with the test name is facing upward. Slide the test strip into the test strip guide in the direction indicated by the arrows. Slide the test strip in as far as it will go. A beep indicates that the meter has detected the test strip, provided the beeper is enabled. If you use a new test strip lot and have not inserted the code chip yet, you must do so now. Check that the number on the code chip matches the number on the label of the test strip container. The hourglass icon shows that the test strip is warming up. When the warming up process is complete, a further beep, provided the beeper is enabled, indicates that you can now apply blood. The blood drop icon flashes to indicate that the meter is ready to perform the test and is waiting for blood to be applied. A countdown begins. You must apply the drop of blood to the test strip before the countdown ends. Otherwise you will receive an error message. When the test is running, no operator action is required. The display dims to save energy. Applying blood from the fingertip. Now lance the side of a fingertip with the lancing device. We recommend obtaining the capillary blood from the side of the fingertip as this causes the least pain. Massage the lanced finger gently until a drop of blood is formed. Do not press or squeeze the finger. Apply the first drop of blood from the finger. Apply the blood directly from the finger to the semicircular, transparent sample application area on top of the test strip, or you can touch the blood drop against the side of the sample application area. The test strip draws up the blood by capillary action. During this process you must hold the blood drop to the test strip until the flashing blood drop icon has disappeared and the meter beeps. You can also apply the blood using the optional CoaguChek capillary tube. Apply the blood drop to the test strip within 15 seconds of lancing the fingertip. Applying blood after this period of time may lead to an erroneous result, as the coagulation process would already have started. Getting a good result from venous whole blood. For sample collection, use a standard blood collection device. Do not use anticoagulants, for example, ETA, cheatrate, fluoride, oxalate, or heparin, to collect the blood sample. Venous blood samples may be collected from a venous line. If venous samples are collected by venipuncture, note the following. Use a needle at least 23 G, approximately 0.65 mm or larger in size. Applying blood with a syringe. Discard the first 4 drops of blood collected within the first 10 seconds. Then immediately apply 1 drop of blood, at least 8 microliter, directly onto the target area of the test strip. Ensure that no air bubbles are introduced into the sample. Apply the blood drop to the test strip within 30 seconds after blood collection. Applying blood after this period of time may lead to an erroneous result, as the coagulation process would already have started. If too much blood has been applied, greater than 20 microliter, the exterior of the meter and the test strip guide should be cleaned and disinfected. You hear a beep tone when you have applied enough blood, provided the beeper is enabled. The blood drop symbol disappears and the test starts. Do not add more blood. To avoid error messages, do not touch the test strip until the result is displayed. The meter performs an automatic quality control test on the test strip before it displays the test result. QC appears in the display. Following a successful outcome of the quality control test, a check mark appears after QC. The result is automatically saved. Results that are above or below the measuring range are indicated by the symbols greater than, above, or less than, below. If a C is displayed along with the result, this may occur if the hematocrit value is very low or due to erroneous blood collection. For example, wet hands. Repeat the test. If a asterisk is displayed along with the result, this may occur if the test result is out of normal range. Touch the asterisk icon to display the out of normal range information screen. When interpreting results, Refer to the detailed information on limitations and interferences included in the limitations section of the test strip package insert. Accepting or rejecting a test result, please refer to the operator's manual. Adding comments. You can add up to 3 comments to a test result. Comments can provide, for example, additional information about the test conditions or the patient. A comment may be up to 20 characters in length. You can open the function for adding comments directly in the results screen. To add comments, in the test screen, touch the speech bubble button. Select the desired predefined comments from the display list if configured, or touch Custom to enter your own custom comment. Use the keypad to enter your comment. Once you have selected the desired comments, touch to return to the results screen. Displaying the test result as QR code. The QR code icon only appears if the QR code display function is activated. See the setup video section QR code. Otherwise it is not displayed. After the test result is displayed, touch the main menu button. You will be prompted to remove the strip. Remove the test strip from the meter. Power the meter off. Clean the meter if necessary. For the performance of stat test, please refer to the operator's manual. Preparing to perform a liquid quality control test. Prepare for a liquid quality control test in the same way you would prepare to perform a test with a capillary blood sample. The only difference is the use of control solution instead of blood. If you want to perform an APTT control, the parameter needs to be activated on the meter. See video meter setup, parameter configuration, parameter activation. Have the test strip container at hand. If you are using the test strip lot for the first time, make sure that the code chip that came with these test strips is at hand. Make sure the bottle of freeze-dried, lyophilized control plasma and the dropper for making the control solution are at hand. This bottle should remain refrigerated, not frozen, until use. Make sure that the quality control code chip that came with the control solution is at hand. Open the lid of the bottle and remove the rubber cap. Hold the dropper with the sealed dropper neck pointing upward. Then cut off the end of the cap with scissors. Do not hold the dropper close to your face. Apply gentle pressure to the reservoir to transfer the entire contents of the dropper to the bottle. Make sure that the dropper does not come into contact with the dried control plasma. Close the bottle again. Make sure the dropper is at hand for the next steps in the liquid quality control test. Swirl the bottle using a circular motion to completely dissolve all of the control plasma inside. Do not shake the bottle or turn it on its side. Doing so can cause components in the control plasma to stick to the sides of the bottle. Please refer to the control solution package insert. The control solution is now ready to be applied to the test strip. Performing a liquid quality control test. Place the meter on a level, vibration-free surface or hold it in your hand so it is roughly horizontal. Power the meter on by pressing the on button. You can also power on the meter directly by inserting a test strip or connecting the power adapter. Wait until the main menu is displayed, or log on. Check that the date and time are correct. Correct any wrong entries as described in Chapter 3, Meter Setup, setting the date. Touch Control Test. Touch the button to select the parameter you want to use. The test strip icon prompts you to insert a test strip. Remove a test strip from its container and close the container again with a stopper. Hold the test strip so the lettering with the test name is facing upward. Insert the test strip into the test strip guide in the direction indicated by the arrows. Slide the test strip in as far as it will go. A beep indicates that the meter has detected the test strip. If you are using a new test strip lot and have not inserted the test strip code chip yet, you must do so now. Select the code stored for your current control solution or touch New Code to use a new control solution. When entering or selecting a code manually, make sure it matches the code printed on the bottle of the control solution. Alternatively, the control solution code can also be entered using the built-in barcode scanner. touch scan and scan the barcode on the label from a distance of approximately 10 centimeters, 4 inches. The meter beeps once the barcode has been read successfully. The barcode information appears in the code field. The scanner turns off after 10 seconds, if a barcode is not scanned. If performing more than one level, select the level for this measurement. You must apply the sample within the displayed time, otherwise you will receive an error message. Using the dropper, draw up the dissolved contents of the bottle. Do not add more control solution. You hear a beep when you have applied enough control solution, provided the beeper is enabled. The acceptable range of results for the liquid control is displayed below the current result, along with pass or fail. If a quality control test fails, an up arrow too high or a down arrow too low is displayed and flashes. Note, the arrow next to the result refers to the end result only. If you want to add a comment, touch the speech bubble button. Select the desired predefined comments from the pick list if configured, or touch Custom to enter your own custom comment. After the test result is displayed, you will be prompted to remove the strip. Remove the quality control code chip from the meter and store it with the controls. Clean the meter if necessary. See video maintenance and care. Proficiency testing. Proficiency tests are performed on samples whose values are unknown to the operator performing the test. These samples are provided by an external source, and the results should be forwarded to the appropriate source after completing the test. The samples supplied are treated in the same manner as regular patient samples. Proficiency testing provides another means of verifying that your technique, reagents, system, and testing performance are as they should be. Preparing to perform a proficiency test. You prepare for a proficiency test in the same way you would prepare to perform a test with a capillary blood sample. The only difference is the use of the proficiency sample supplied instead of blood from a patient. To perform a proficiency test you need the following. The information of at least one code chip for test strips must be stored in the meter and must match the lot number of the test strips used. The correct test strips must be available. The proficiency sample must be available. If you are using the test strip lot for the first time, make sure that the code chip supplied with these test strips is at hand. Performing a proficiency test. Place the meter on a level, vibration-free surface or hold it in your hand so it is roughly horizontal. Power the meter on by pressing the on button. You can also power the meter on directly by inserting a test strip or connecting the power adapter. Wait until the main menu is displayed, or log on. Viewing test results. Place the meter on a level, vibration-free surface, or hold it in your hand so it is roughly horizontal. Select the type of results you want to view. Display patient result memory. Display QC result memory. Select the test parameters you want to view. Display patient result memory. The QR code icon only appears if the QR code display function is activated. Otherwise it is not displayed. Display QC, quality control result memory. Recommended cleaning, disinfecting agents. A soft cloth slightly dampened, not wet, with a small amount of liquid soap diluted in water. Rubbing alcohol, 70% ethanol or isopropyl alcohol. Alcohol-based disinfectant, a mixture of 1-propanol, 400 mg per gram, 2-propanol, 200 mg per gram, and glutaraldehyde, 1.0 mg per gram. Disposable wipes containing quaternary ammonium compounds up to 0.5%. Single compound or mixture in isopropyl alcohol, isopropanol, up to 55%. Cleaning, disinfecting the exterior meter housing. Use the solutions recommended for cleaning, disinfecting the meter exterior. Apply the solutions for a contact time of greater than 1 minute. Power off the meter. Then gently wipe over the surfaces, touchscreen, housing with a soft, Lint-free cloth slightly dampened, not wet. With a fresh dry cloth or lint-free tissue, wipe away residual moisture and fluids after cleaning the housing. Visually verify that no solution is seen anywhere on the housing or touch screen at the completion of cleaning and disinfecting. Allow wiped areas to dry for at least 10 minutes before performing the next patient test. Ensure that the blue test strip guide cover remains tightly closed while cleaning the meter housing. Do not let liquid accumulate near any opening. Ensure that no liquid enters the meter. If you notice streaks on the housing or touch screen, or the touch screen surface becomes slightly cloudy, wipe clean immediately with a soft, lint-free cloth slightly dampened with water. Cleaning, disinfecting the test strip guide. Use the solutions recommended for cleaning, disinfecting the test strip guide. Apply the solutions for a contact time of greater than 1 minute using lint-free cotton swabs, buds. With the meter powered off, remove the test strip guide cover to clean it. Move the cover safely away from the meter. Then rinse the cover with warm water or wipe it clean using the solutions recommended above. Let the test strip guide cover dry for at least 10 minutes before reattaching it. Hold the meter upright with the test strip guide facing down. Clean the easily accessible white areas with a moistened cotton swab, bud. Ensure the swab, bud is only damp, not wet. Wipe away residual moisture and fluids. On completion of cleaning, with the cover off, let the test strip guide dry for at least 10 minutes before reattaching the test strip guide cover and testing again. Visually verify that no residual moisture is seen anywhere on the test strip guide and cover at the completion of cleaning and disinfecting. Ensure that the test strip guide and cover are completely dry before assembling them. Reattach the test strip guide cover to the housing. Make sure that the cover is properly closed. You will hear it snap into place. Cleaning the scanner window. The scanner window should be cleaned periodically. Use a clean, dry cloth to wipe the scanner window,